Consumerism is an interesting discussion because for most of the healthcare industry, they're thinking about how to bring more consumerism into their organizations, into the way that they interact with the market. For Weight Watchers, we've been better part of a half century actually deep in the consumer market, and we're trying to figure out how we can partner into the healthcare industry. So consumerism actually is what we're all about. We don't have a revenue base, we don't have a profit base if we're not succeeding in actually delighting the consumer, inspiring the consumer. I talked a little bit in the panel about the fact that one of the important things we think about is this holy trinity, this area of accountability, inspiration, and support. And when we think about consumerism, those pieces are pieces that the consumer demands of our services in order for them to feel satisfied and for them to get value. Ultimately, they measure it based on the weight that they lose, but they will only take this journey with us if they're seeing these aspects of accountability, inspiration, and support as part of what we bring as our services moving forward. Yeah, data is really important to us, partially because when we're thinking about the relationship that we have with our consumers, we're looking about this basically being a membership or a subscription that they're purchasing from us. And we're always watching to understand what's causing them to engage with us, enroll with us, and ultimately what caused them to retain the relationship with us over time. And so the only way we can really see that is by really paying close attention to longitudinal data and making sure that we're thinking about the services we provide. We have a very strong mobile platform. We have a very strong online platform in addition to our meetings business. And it's how all of those work synergistically around supporting the member that really makes it all work. And it's the data that pulls it all together. The other aspect for health solutions actually recently is starting to appreciate how important our data can be to the rest of the healthcare ecosystem. So things like, are they participating? Are we seeing enrollment? Are we seeing appropriate net weight loss? And are we providing it back to the system in ways that they can actually build into EMRs, they can build into a better understanding of the patient in their totality? So we've done a very significant level of investment to build up our data warehousing capability, our data handling capability, to make it more healthcare compliant, and so that it can be helpful not just to our consumers, but frankly to partners, payers, providers who want to start to use Weight Watchers as the partner of choice for helping them around weight and obesity management issues. One of the reasons that plans look to Weight Watchers is because they're dealing with their chronic spending, and in particular they're dealing with diseases like diabetes that are very obesity related. So they know that if they provide us a better understanding of what the patient is grappling with and perhaps other issues that are going on in their overall wellness state, we can then do a better job of servicing those patients as we move forward. I'd say we're in the first stage of that journey. I think over time we're hoping that we can use the data from the plan and then combine our data into that to create a more robust support service generally around that patient. I think generally the shift towards consumerism as well as the shift around technology in the industry are two of the probably biggest propellers of change within the overall healthcare area. And for us, what gets exciting about consumerism is we know generally when consumers can control their healthcare spend, when they can influence the choices that they will pick, that organizations like Weight Watchers will tend to stand out in those situations because we're set up to be a very consumer-friendly organization. But what's also interesting for us about this situation is when you take a program like a Weight Watchers and you plug it into a broader provider network or a broader payer network, we can help the net promoter scores, we can help in general how the consumer feels about their entire experience with an organization. And so if you imagine a continuum of care where somebody is having to eventually deal with a knee replacement and they're able to get some weight management services before they go in for the surgery to help to get their weight to an appropriate level. And then after the surgery, we play a role in the rehabilitation of that patient so that they can get a full continuum success. That's a very, very interesting way to think about that episode of care. For us, we think consumers will like that, and we think that more and more we're going to see shifts in the industry towards those approaches.